We've all been to a fairground and gone on a ride that feels thrilling at first, but then you just want it to stop. It all feels a bit out of control. You wish you'd never agreed to get on it, but you didn't want to let the side down. Having surgery can feel a bit like this. You've got a painful hip and the consultant says you need to have an operation. Your family and friends just tell you to get on with it and you'll be fine. But there's this nagging doubt that it's not really what you want. You've been to the preoperative assessment clinic, read all the patient information books, and everything is in place for your admission to hospital. The next thing you know, you're in your room on the morning of surgery. For most people, this is what you've been looking forward to for months. At last, you'll be free of pain, and soon you'll be able to get on with your life again. For some people, though, it feels as though they are suddenly having to confront the fact that it's not really what they want. It's quite normal to feel anxious about the thought of having surgery, but if you really don't want to go ahead, what do you do? If you're my patient, then you've probably met me a couple of times already, and we will have discussed in detail what's involved and what to expect. When you come into hospital, I see you, we go through the consent form, and I put a mark on your leg so that we know exactly which side we're going to do. The first question that I ask, though, is do you still want to go ahead with surgery? Some people think I'm bonkers for asking the question, but once or twice a year, a patient will say to me, do you know what? I don't think I do. The pain's not as bad as it was when I last saw you, and I'm not really sure about going ahead with the operation. Earlier this year, a patient came to see me and booked in for surgery. When I saw him in his room on the day of surgery, he was really apprehensive, so I sat down with him and we talked about how he felt. He admitted that his symptoms had got better because he'd lost a bit of weight and he was able to exercise a bit more. I said to him, if that's the case, then there's no point in having surgery today. The only reason to go ahead with it is if the symptoms are really intrusive. I asked him to think very carefully about what he wanted to do and suggested that I come back and see him after I'd done my first case. Do you know what? He decided not to go ahead with the operation. He was so relieved and happy to have been given the opportunity to get off the ride. I said that I'd see him in clinic in a couple of months, by which time he'd have a much better understanding of what was happening to him. He went home looking relieved and happy. 3 months later, he decided to go ahead with the surgery. He had no doubts at all about his decision and was mentally much better prepared. So if you're having doubts about having your surgery, but you don't quite know what to do, don't be afraid to say no, even if it's on the day of surgery. We all understand how stressful it is to put your trust in a process that you don't really understand and that feels quite threatening. All that we want to do is to give you the best possible outcome. If that means coming back another day, well, that's just fine. You feel better about making the decision and I get to go home a bit earlier. Everybody's happy. If you'd like more information about this, please get in touch. The details are below. Thanks for watching.